conclusion was that taking up to 600 milligrams did not cause an increased risk for arrhythmias. What is up, team? This is Quinn Stilson with the Quan Coaching Podcast. Today, bringing you episode number 7. It's going to be all about caffeine, the number one drug or supplement that's used in America. 90% of Americans are ingesting caffeine in some source or another. We're going to talk about how our body uses it to arrive at certain effects, both positive or negative. We're going to talk about the doses that you need to arrive at certain effects, the doses to avoid negative effects, and then we're also going to talk about my final recommendations for how to use caffeine to arrive at certain long-term or short-term benefits. Before we get into all of that, I did want to mention that we have a few in-person coaching spots available, as well as some online coaching spots available as well. Or even if you want me to just make an individualized, comprehensive coaching plan for you after a free consultation, and then you never want to talk to me again, we can also do that. So really, we can work with any budget. Do not hesitate to reach out. All the contact info is at thequancoaching.com. So with that, let's get into the topic of the day. Again, it is caffeine. Caffeine is a drug that 90% of Americans are taking every day. It's a drug that accounts for a $102 billion market value, and it is a drug that has a ton of purported benefits and also a ton of purported risks or like negative side effects of taking this drug. We're thinking benefits-wise, we're talking increased cognitive ability, increased attention span, increased focus. We're thinking about an increased aerobic power, an increased muscular strength and power. So really benefits from the spectrum of cognitive and mental ability all the way to physical and muscular strength ability. And then, however, we do have some negative side effects that are often talked about. Does caffeine cause arrhythmias? Does it cause increased cardiovascular disease risk? Does it cause an increased risk for cancer? Does it cause an increased all-cause mortality? There's many things that caffeine has been rumored to do negatively as well. So I want to talk about all of these today. I want to debunk the myths. I want to give you the science and tell you what that says so you can actually make an informed decision for yourself about how much caffeine you should be taking depending on what risks you're willing to take, as well as what benefits you actually want to receive from caffeine. So to start this whole discussion off, I thought it would be a good idea to talk about how much caffeine is in certain products, so you can get an idea of how much caffeine you might be taking or how much caffeine you need to take in order, again, to arrive at those benefits or to avoid those risks. Coffee, starting there, has 50 to 160 milligrams per 8 fluid ounces. So again, you don't really know exactly how much caffeine you're ingesting. However, it really does depend on the type of coffee. If you're looking at like a brewed coffee, you're looking at closer to the hundreds, versus if you're looking at more of an Americano coffee, you're looking at closer to the 60s, 70s. Outside of coffee then, the second biggest caffeine ingestion source is tea. And tea is much less than coffee. It's only about 15 to 50 milligrams per 8 fluid ounces. And again, this depends on the type of tea. You don't know exactly how much you're ingesting, but a black tea in general is going to be closer to the 50, versus a green tea is more in the middle of that 15 to 50 range, and then a white tea is closer to that 15 milligrams. Then talking about soft drinks, the next common source, that is going to be about 20 to 40 milligrams per 8 fluid ounces. So it's more similar to tea. And again, it totally depends on the exact soft drink that you're ingesting. And then outside of that, so again, coffee, tea, and soft drinks account for 96% of caffeine ingestion. Other 4% is coming from, we already mentioned caffeine pills or caffeine powder being another source. Outside of that, we're thinking about energy drinks or energy shots. You can also get caffeine from chocolate or some other food sources in very small amounts, or even medications such as Excedrin, which is taken for migraines, also has about 65 milligrams of caffeine in it. And we'll talk about why caffeine actually helps migraines in a bit. So those are kind of your sources of caffeine. You can think about now how much caffeine you might be taking in per day. So for instance, if you're having 4 to 5 cups of coffee a day, you're looking at about 400 milligrams of coffee or of caffeine per day. So With that now, I want to talk about, after we're ingesting it, how does our body actually use caffeine to arrive at effects? So I want to get into the pharmacology, really like the science behind caffeine here. So the first point that's very important when talking about the pharmacology of caffeine is how rapidly it's absorbed. When you drink that cup of coffee or you take those caffeine pills or the cup of tea, in 20 to 40 minutes, you're going to arrive at your peak plasma concentration of caffeine. So it does not take much time at all for all of it to be absorbed and into your bloodstream. And another aside here is to say that all of these sources of caffeine that we just talked about, they've done studies that have shown that it does not matter what source you're getting the caffeine from. They all get to your bloodstream in the same manner and around the same time. So taking caffeine pills does not cause you to have a higher risk of arrhythmias or a higher risk of cardiovascular disease compared to coffee. If you're having the same amount of milligrams from caffeine pills as you would be from coffee, there's no difference. So, quick little aside there. But again, now back to how our body absorbs this caffeine. First point, as I just mentioned, is it does it very rapidly. 20 to 40 minutes is all it takes for all of it to be absorbed. And I do say all of it, but it's very close to all of it. It's actually 90% absorption, which is actually a lot when it comes to drug absorption within the stomach. Most drugs are not fully absorbed. They are sometimes excreted through the GI tract without all of it being absorbed. And caffeine, however, has a very high percentage. Like I said, 90% being absorbed. So 90% of it is absorbed. It's absorbed very quickly. Now, once it's in the bloodstream, how is it going to have its effect? Well, there's three primary mechanisms by which it has been purported to have an effect. And the scientific community, based on a lot of basic science studies, has really narrowed it down to one mechanism that they believe to be the primary effect for caffeine. And that is antagonism of adenosine receptors. So we're going to break that down. First, we're going to need to talk about adenosine receptors. What does that do? Well, adenosine receptors are throughout the entire body. They're in your brain, they're in your heart, they're in your lungs, in your GI tract, so your stomach, your colon, intestines, etc., in your kidneys, liver, etc. So these adenosine receptors are all over your body. And depending on where they are in your body, we're going to get different effects when adenosine binds to them. So if, for instance, we're in the brain, we're looking at these adenosine receptors in the brain. If adenosine binds to the adenosine receptor in the brain, what we're going to get is what essentially is a downer response. So we're going to inhibit excitatory neurotransmitter release. Neurotransmitters are essentially just molecules that flow in the bloodstream to eventually enact certain responses. And what adenosine does to these neurotransmitters is it inhibits their release. So we're talking about the neurotransmitters norepinephrine or glutamate. These neurotransmitters are excitatory, and adenosine is essentially blocking their release. So if we're blocking the release of excitatory neurotransmitters, we're getting a fatiguing or quote downer response. So that's the effect in the brain or the central nervous system. However, what are the effects at other places? Well, in the heart, adenosine receptors do a couple things. If adenosine binds to the receptor in the heart, it causes decreased contractility of the heart and a decreased heart rate. Decreased contractility meaning essentially just how hard the heart is going to squeeze. So if we're blocking that, again, caffeine is an adenosine receptor antagonist. Antagonist meaning it blocks the receptor. It blocks adenosine's effect at the receptor. If caffeine blocks that in the heart, essentially we're going to get the opposite effect. So we're going to get increased contractility or increased strength of that pump of the heart, and we're going to get an increased heart rate due to caffeine's effect. And talking about the adenosine receptors on the heart is actually a very interesting topic as far as the medical community is concerned, because we actually give adenosine to patients who are in these fast heart rhythms or these arrhythmias. So if a patient's in something called SVT or supraventricular tachycardia, we actually give adenosine because adenosine is going to slow the heart rate when it binds to those adenosine receptors in the heart. So that's the heart. We already talked about the brain. Another place that adenosine receptors are the vasculature, or your blood vessels, your arteries, your veins. Now, when adenosine binds to receptors there, it causes vasodilation, or essentially it widens the blood vessels. Now, again, we take caffeine into the picture. We're blocking that effect of adenosine. We're going to get the opposite effect. So we have caffeine come in. Now we're going to get vasoconstriction, or we're going to tighten those blood pressure or those blood vessels, which you can imagine if you are making a vessel smaller, and then now we're also pumping harder with the heart and faster. So we're making more blood flow through smaller vessels. You can imagine it's going to increase your blood pressure. And that's kind of the mechanism for how caffeine would increase your blood pressure and increase your heart rate. It's all through these adenosine receptors, or more accurately, it's all through antagonizing these adenosine receptors. So that is the first method that adenosine works within the body. And that's really the primary mechanism for most of the actions of caffeine that we're going to talk about. Now, there's a couple other mechanisms. However, it's worth noting that these couple other mechanisms that we're about to talk about are really only active when we take high doses of caffeine. So the adenosine receptor antagonism actually occurs only when you take 30 milligrams. So you have a cup of tea, this adenosine receptor blocking is going to start to occur. Versus these other mechanisms are only going to occur when we're taking upwards of 300 milligrams acutely. Now, these other two mechanisms, first off, is an increase in intracellular calcium. So the increase in intracellular calcium, why that's important is calcium is important for muscular contraction. I won't get into the entire mechanism right now for sake of time, but by increasing calcium, you have a stronger contraction. Thus, this could be why caffeine is allowed to increase muscular strength and increase muscular power, because we're increasing muscle contraction. However, again, only occurring at higher doses of caffeine, that 300 plus milligrams. Now, another mechanism is phosphodiesterase inhibition. So a phosphodiesterase, essentially what it does is it decreases a molecule known as cyclic AMP, or CAMP. Thus, if we're inhibiting phosphodiesterases, we're going to increase cyclic AMP. Now, increasing cyclic AMP does a couple of things. One, as far as our purposes for caffeine's effects go, one, it increases hormone-sensitive lipase, or HSL. By increasing HSL, you're essentially increasing fat oxidation, or you're increasing your body's ability to use fat as an energy source. So as you can imagine, it's been purported that caffeine decreases body fat percentage because you're increasing your body's ability to oxidize fat. And probably more importantly for the purposes of caffeine, what this is doing is it's using fat as an energy source instead of muscle glycogen. Therefore, if you use fat instead of muscle glycogen, you're sparing that glycogen and you're allowing your body to use fat to propel yourself in aerobic exercises specifically. Thus, you can imagine that you have more energy now, that since you're able to use that fat as an energy source, you have more energy for those aerobic events, allowing for increased aerobic performance. So that's one purported mechanism as far as why caffeine might help with aerobic endurance activities, is an increase in hormone-sensitive lipase, which causes increased fat to be used as an energy source. And then also cyclic AMP also is involved in a lot of metabolic processes as far as the regulation of glucose and glycogen. So we can also start to see why caffeine could cause differences in glucose metabolism, which is very important when we're talking about diabetes. So those are the three mechanisms by which caffeine works. Again, antagonizes adenosine receptors, which is the primary mechanism, and it works at all caffeine dosages. And then the other two, increasing cyclic AMP and increasing intracellular calcium, which both work at higher caffeine doses and are more secondary mechanisms in regards to caffeine's effects. So far we've got caffeine rapidly absorbed, and 90% of it is absorbed within 20 to 40 minutes. We're already arriving at our peak plasma concentration. then it's starting to get through the bloodstream. It's traveling to all your different organs and working through the mechanisms we just talked about. However, after it works through those mechanisms, caffeine has to be cleared, right? If it wasn't cleared, and this is the same for every drug, if it wasn't cleared, it would stay in your body forever and continually have these effects, which would obviously be very dangerous. So your body is clearing drugs such as caffeine, but how does it do that? And how it does it is actually very important to understand as we start to talk about sensitivity to caffeine. You'll often hear about people saying, "Oh, I'm so sensitive to caffeine, even 50 milligrams would make me so anxious." Or you'll hear about people taking 400 milligrams and saying that they're totally fine and they're feeling no effect 3 hours later. Well, that's due to probably two things. One, it's possibly due to tolerance and habitualization, meaning if you work your way up to taking 400 milligrams of caffeine, you're not going to have the same effect compared to someone who just takes 400 milligrams and has never taken caffeine before. So that's one thing. We're going to talk about that more in a second. But the second is people are actually genetically predisposed to either be very sensitive or not very sensitive to caffeine, and everybody lies somewhere on that spectrum. The reason being is that caffeine is metabolized by a molecule known as cytochrome P450 in the liver, and this is kind of a famous molecule as far as drug metabolism goes, and it's encoded for by another molecule known as CYP12A. Now, genetic differences in cytochrome P450 cause differences in how fast you metabolize caffeine. So caffeine's half-life is on average about 5 hours. And a half-life, for those that maybe aren't aware, is how long it takes for half of the drug to be eliminated. So the average is about 5 hours. However, the range of half-lives when looked at in human studies is anywhere between 3 to 10 to 12 hours even. So it's a huge range. And the reason that it is a huge range is one, and probably most importantly, due to this genetic difference in cytochrome P450. So this enzyme cytochrome P450, which is in the liver, breaks down caffeine, but if you have a cytochrome P450 molecule that doesn't break down caffeine as fast, your half-life is going to be much longer and you're going to be much more sensitive to caffeine. So if you take 400 milligrams, for you, that if you're sensitive to caffeine and your cytochrome P450 doesn't metabolize it very fast, then 400 milligrams becomes 200 milligrams in maybe 10 hours. So caffeine is going to be in your system for a long time and you're going to feel more sensitive to caffeine. You're going to feel more of those anxiety-provoking effects versus someone whose cytochrome P450 metabolizes caffeine very rapidly. They're going to quickly clear it from their system and they're going to feel like it doesn't touch them. So it's actually not a myth. People are more or less sensitive to caffeine based on that cytochrome P450 molecule. So that's one reason why the half-life is so variable, but there's actually more reasons. One is the circadian rhythm actually changes how this cytochrome P450 molecule is expressed. So for instance, in the morning, your cytochrome P450 might be upregulated, causing, if you take caffeine, it's going to be metabolized much faster. Versus if you take caffeine at night, your cytochrome P450, now regulated by the circadian rhythm, is now at lower levels. And now because cytochrome P450 is the molecule that metabolizes caffeine, because it's at lower levels, caffeine is going to be allowed to stay in your system longer. So that also regulates why this half-life is so variable and why caffeine metabolism is therefore so variable. Other reasons, one being oral contraceptive pills or birth control. Birth control is a hormone that is actually also metabolized through the cytochrome P450 molecule. Thus, if you're taking birth control, you're taking up that cytochrome P450 that could be used to metabolize caffeine because you're using it to metabolize your birth control. Because of that, you don't have enough cytochrome P450 to metabolize the caffeine, and thus caffeine is going to be allowed to stay longer in your system, up to probably 2 times as long. So if you're on birth control, you're going to be more sensitive to caffeine. Similarly, if you're pregnant, you're also going to be more sensitive to caffeine, and this is why they say to limit your caffeine intake if you're pregnant. So what we're going to talk about later is that Anything less than 400 milligrams of caffeine, you're safe. However, in pregnancy, they recommend less than 200, and that's because the reason that I just talked about with the birth control pills. Due to hormonal changes in pregnancy, we're going to have less cytochrome P450 that allow us to metabolize the caffeine. Thus, caffeine is going to be able to stay in our system longer. Thus, we're going to need to take less of it if we're pregnant. And then another final cause that we'll talk about as far as varying sensitivities to caffeine is substance use. 2 specifically, 1 cigarette use and 2 alcohol. They actually have opposite effects. So for cigarette use, it actually doubles the rate. So if you're a chronic smoker, it doubles the rate of caffeine metabolism by upregulating those liver enzymes or upregulating that cytochrome P450. So if you smoke, you're going to be less sensitive to caffeine. And 2 is alcohol consumption. Alcohol actually increases the half-life of caffeine. So if you take alcohol at the same time that you take caffeine, you're going to see that the caffeine lasts longer in your system because it's decreasing the clearance of caffeine. So let's summarize all of this science before we move on. We talked about a lot so far. So we take in caffeine from one of the sources that we talked about, rapidly enters your system. In 20 to 40 minutes, you have the highest level of caffeine that you're going to have after you ingest it. Then caffeine starts to antagonize adenosine receptors everywhere in your body. It increases intracellular calcium and it increases cyclic AMP. And then after it's done all of this, it's also being eliminated. So we get it out of your body by metabolizing it in the liver. However, that process is very variable depending on individual genetic susceptibility as well as external factors such as birth control, alcohol use, cigarette use, etc. So with that, I want to talk about 2 more scientific topics that are going to really help us understand caffeine use, and that is tolerance and withdrawal. So caffeine tolerance is a hugely important point as far as we get farther along in this discussion. Essentially what happens with tolerance, and this happens with a lot of drugs, but it also happens with caffeine, is as you start to take caffeine, your body is going to say, okay, we're antagonizing all of these adenosine receptors, but we need these adenosine receptors. Essentially, caffeine is causing you to have an upper effect, but your body is saying, okay, we don't need that much upper effect. We need the downer effect as well. So what is your body going to do to counteract this, to get that downer effect? Well, it's going to do 2 things: increase adenosine receptors, or it's going to increase the sensitivity of those adenosine receptors to adenosine. So what you're going to find in people who chronically take caffeine is an increased amount of adenosine receptors that allow them to, again, get that downer effect and to kind of maintain homeostasis or maintain that balance of the upper and the downer. And this happens over time. And what you'll see in studies is this is proven practically as well, because you'll see that the effects often go down over time. So for instance, they looked at the aerobic performance benefits as well as the muscular power benefits of caffeine over a 30-day span of consistently taking caffeine. What they found was up until day 14 or 15, you were actually still able to get benefits from taking caffeine, both aerobically and anaerobically. However, after that, you started to see no benefit when the individuals took caffeine. Mechanistically, that's due to the increased adenosine receptors. And essentially what that means is you're only going to see effects of caffeine when you are not tolerated to it, or when you have not created an increased tolerance due to habitually taking caffeine, or at least you're going to see much less of an effect of caffeine if you have this tolerance built up. Now, going hand in hand with tolerance is the topic of withdrawal. Withdrawal is essentially if you take out caffeine and now we stop cold turkey, what's going to happen? Well, withdrawal is going to happen. So what you can imagine is while we have habitually taken all of this caffeine, our body is, again, we're trying to maintain that balance. So it's increasing all those adenosine receptors. It's increasing those receptors' sensitivity to adenosine. Now we take off caffeine. We take off that antagonistic molecule. Now we have all of these adenosine receptors built up and all of their sensitivity is increased. So if we have no caffeine to antagonize them, now we just have this adenosine flood. And we already talked about what adenosine does, right? It's a downer. So it's going to cause fatigue. It's going to cause depressed mood. And that's really two hallmarks of adenosine increase or caffeine withdrawal. Another thing it causes is headaches. So if you've ever withdrawn from caffeine, you'll know what this is. You'll know the syndromes of increased fatigue, increased headaches, a depressed mood. Headaches, for instance, could be correlated with increased blood flow to the brain. As I talked about, adenosine causes that vasodilation or the increase in diameter of the blood vessels, and caffeine therefore causes the constriction. We take off the caffeine, we're going to further dilate the blood vessels, and this has been purported to possibly be a cause of the headaches as all of this blood flow is rushing to your brain. So that's kind of the syndrome of caffeine withdrawal. I know this very well. I started taking, as I mentioned, I've taken these caffeine pills. I started taking these in undergrad when I was scribing in the ER and doing these overnight shifts. A friend recommended these in order to stay focused on the shift. So I started taking the caffeine pills and I started to work my way up and to taking almost up to a gram of caffeine per day. And then during winter break in undergrad, I decided I was going to completely cut out caffeine because I was afraid of the risks that we'll talk about. When I completely cut them out, what I found was I was sleeping for almost 10 days. I was sleeping for about 14 hours a day, had a very depressed mood. I was just totally tired, had headaches in the mornings. It was just a terrible time. So that's caffeine withdrawal, very real thing. Peak symptoms are going to be 1 to 2 days after you stop taking caffeine, but the syndrome can last up to 9 to 10 days after you stop taking caffeine. So that's tolerance and withdrawal. And again, it's a very important discussion to have because what you'll find, as I mentioned, is as you're tolerated to caffeine, you're going to get lesser and lesser of its positive effects. So what you're actually going to start to see is a large portion of what you perceive to be a benefit from taking caffeine is actually due to staving off those withdrawal symptoms. The withdrawal symptoms can start 12 hours after your last caffeine intake. So you can imagine if you're very habitualized to taking caffeine, you take it at night, or if you take it at maybe 6 p.m. and then you don't take it, you go to sleep and you wake up at 6 a.m. the next day, well, guess what? You have just went 12 hours without taking caffeine. Or maybe you even take it in the afternoon and you say, okay, I'm not going to take it because I'm not going to take it in the evening because I want to sleep well. Well, you've taken maybe, say, 400 to 600 milligrams up until 2 p.m. You don't take it again until 6 to 8 a.m. the next morning. Well, that's way over 12 hours. You're going to start to see those caffeine withdrawal effects. Again, they're going to be less effects than maybe what I did when I went off of it for 24 hours. You're only going off for 12, but you're going to start to feel more fatigued. So when you wake up in the morning and you feel fatigued, you're probably just thinking, okay, I'm tired, I need a cup of coffee. Well, while that may be true, I think a large part of the fatigue is probably due to this caffeine withdrawal. So then you just have to take caffeine to get back up to your baseline status. So you feel or you perceive a benefit of caffeine, but in reality, you're just staving off that withdrawal effect. And then you take caffeine and it starts to get eliminated from your system. And again, now you feel more fatigued, so you take caffeine to get back up to that baseline level. You're again staving off those withdrawal effects. So essentially, you're kind of just chasing that high after you've already been habitualized to it. Versus if you're not habitualized or if you're caffeine naive, as they say in the scientific studies, you're going to actually arrive at those acute effects, those acute positive effects especially, that we're about to talk about in a minute. So again, keep that in your back of your head. We're going to talk about that again as far as how it relates to what I would recommend as far as taking caffeine goes. keep that tolerance and withdrawal and all of this science in the back of your head. It's going to be very important as we progress to talk about the effects, both positive and negative, and the final recommendations as far as how to use caffeine. All right, so with the science there, let's start talking about negative and positive effects, and let's start with the negative effects here before we get into what you're actually reaching for the caffeine for those positive effects. I want to talk about what we need to avoid. So again, there's a bunch of purported rumors, or maybe they're true, about certain negative risks that come with caffeine. Let's break them into two categories. One, acute. So after you take a big dose of caffeine, what are some risks of doing that? And then let's talk about habitual caffeine use and what are the chronic effects or chronic negative effects of that. So starting with acute, let's talk about toxic ingestion. And this is something that people often fear, is you all see these articles that talk about the gym bro who drank XYZ amount of energy drinks and now they are dead because of this caffeine ingestion. And that is those are terrible stories to read about, but you really do need to look at how much caffeine ingestion they took. And what the studies have shown is that it takes about 10 grams of caffeine to be fatal. 10 grams, so that is taking about 100 cups of coffee, and then that would be fatal. And that's why it's near impossible to have a toxic ingestion or have a fatal dose of caffeine from something like coffee, tea, soda, because the volume that you would have to ingest is just insane. And that is why people, I think, feel that caffeine pills are more dangerous, is because without ingesting a huge volume of fluid, I can take in 10 grams of caffeine pills. However, you're not going to accidentally take 10 grams of caffeine pills. And that's why most causes of caffeine fatality are either purposeful or out of some dare or something of that sort. And obviously these are all terrible stories. But I just wanted to reassure you that I would not be concerned that you're going to accidentally fatally overdose on caffeine. That is just not going to be the case. Again, 10 grams is a very, very significant amount when most people are only taking 400 milligrams a day. So that's the toxic acute ingestion. Again, don't be afraid of that. You're not going to accidentally toxically overdose and fatally overdose on caffeine. Now, the next group of acute effects will group into cardiovascular. So one hugely talked about possible acute effect of caffeine is arrhythmias. What you'd be interested to know, though, is that caffeine has actually been shown to not cause arrhythmias. In patients taking up to 600 milligrams of caffeine, there was no increase in the amount of arrhythmias, even in patients who are predisposed to arrhythmias. So patients who have known AFib or have known cases of SVT, like we talked about earlier, or that supraventricular tachycardia, even in those patients taking up to 600 milligrams, there was no increased risk of arrhythmias. And even some of these patients took, I think, like 1,000 milligrams, and they had no increase. However, the study's conclusion was that taking up to 600 milligrams did not cause an increased risk for arrhythmias. Now let's talk about another category of cardiovascular risk, and that is blood pressure and heart rate. So if you increase or if you take in caffeine, as we already talked about with the mechanism of adenosine antagonism in the heart, you are going to cause acutely increased blood pressure. And it will increase by about 8 points systolically, or that top number of your blood pressure will increase by about 8. Now, that is acutely in caffeine-naive individuals. Now, here's where that tolerance point comes into play and why it was so important that we talked about that. When you look in these studies, what they find is even after only a week, this increase in blood pressure, like I said, that increase by about 8 points becomes negligible. In almost all studies, we found that caffeine intake habitually is not going to increase blood pressure. And if it does, it's only by about 2 points systolically, which really does not have much effect in the grand scheme of things and things that we actually care about, which meaning mortality, heart failure, cardiovascular disease, etc. So caffeine, while it acutely increases blood pressure in the caffeine naive individual, or at least in the individual taking more caffeine than they're accustomed to, if you're taking it habitually the same amount, you're going to, by way of tolerance, you're not going to be increasing your blood pressure anymore by having that cup of coffee that you always have in the morning. Again, that's the same thing with heart rate as well. Now, what we also find is, a caveat to this is increasing your blood pressure, or a caveat to this is those that are sensitive to caffeine or have a predisposition to hypertension or high blood pressure at baseline may be more affected by caffeine. So this is something to consult your doctor about if you do have a predisposition to hypertension. However, what they did find was that those who have controlled hypertension, so you're on medications, say, and your blood pressure is well controlled, it's not running in the 180s plus sporadically, it's very well controlled down into that 130s to 140s even. Taking caffeine, again, no effect chronically as the tolerance dissipates that effect. So far, there's really been no negative acute effects. There's no arrhythmia risk. The blood pressure effect is going to dissipate due to tolerance. Toxic ingestion is not something we need to worry about if we're not purposely trying to take caffeine for toxic reasons. But let's talk about a couple other ones that have been purported or rumored that kind of cause acute negative effects. One of which being a diuretic effect. So diuretic essentially meaning you're increasing your urination. It has been shown that caffeine does have a very mild, emphasis on mild diuretic effect. And often because of that, what you'll see is people recommend to not take caffeine when you might be volume deplete. So say you're going to run a marathon, you might not want to take caffeine because it will diurese you and cause you to lose your hydration status. However, what they've shown in studies is that that is not the case. They looked at runners, for instance, and tested their hydration status with and without caffeine, and all markers of hydration were not changed. So while, yes, in these basic science studies, caffeine does have a diuretic effect, it's not an effect that actually has practical implications. You can take caffeine without fear of dehydration. Another acute effect that's often talked about is two more things that we'll talk about: anxiety and sleep. And so far we've talked about a bunch of effects that are very often talked about but have not had evidence to support their negative effect, such as arrhythmias, such as cardiovascular, blood pressure, heart rate increase, such as diuretic effect. However, these acute effects actually do have science to demonstrate them. Number one, anxiety. So what you'll see, and we'll talk about this a little bit further down in this podcast when we talk about the benefits of caffeine, but what you do see is that caffeine acutely can cause increased anxiety if taken at higher doses. What we typically see is patients or people consuming 200 milligrams or less at a time are not going to see these anxiety-provoking effects. However, you're taking 400 milligrams plus at a time, you might start to feel some anxiety. And then the other negative effect that has science to back it up is sleep. If you take caffeine up to 6 hours before bedtime, you are going to have decreased sleep performance. And what they did was a study specifically that looked at taking caffeine right before bedtime, taking it 3 hours before bedtime, and taking it 6 hours before bedtime. And what they found was in every single scenario of taking it at these certain points before bedtime, you had one, a increased sleep latency, or the time it took to fall asleep, and two, a decreased total time of sleep. So these people were up in the middle of the night longer, or they had a decreased quality of sleep because of taking caffeine. And that is where the recommendation comes, where you should not be taking caffeine up to 6 hours before bedtime. Before that, you still might interfere with sleep, but to a much lesser extent. But taking it 6 hours or closer to bedtime is highly recommended against, because it will decrease your sleep, which will increase your fatigue the next day and decrease your performance in many metrics, decrease your optimal hormones, etc. And that's a whole other podcast to talk about how much that will affect you. But again, so far, the two acute effects of caffeine, two acute negative effects, poor sleep, 1, and 2, anxiety at higher doses. However, you can avoid those by 1, not taking doses of caffeine that are high, so you're avoiding the anxiety by doing that, and 2, you're avoiding these sleep detriments by taking the caffeine earlier in the day. So by doing those, you're really not going to have any acute of negative effects of caffeine. Now let's move on to the purported negative chronic effects. And let's start talking again about the cardiovascular system. So we already kind of talked about blood pressure chronically. As you habitualize to caffeine, you're going to decrease this effect of the increased blood pressure. But what about other cardiovascular markers? So for instance, what about cardiovascular disease or atherosclerosis, if you've heard of that? Well, what they found in studies is, to start it off, there is no increase in cardiovascular disease risk by taking caffeine. And this was shown at all levels of caffeine, even up to 600 milligrams per day. This did not increase your risk for cardiovascular disease. But interestingly, what they found was half of the studies actually demonstrated a slight decrease in cardiovascular disease risk when caffeine was taken. And this was really only shown when patients were taking up to 400 milligrams of caffeine per day. So if you're taking 100 to 400 milligrams of caffeine per day, which is generally what people take on average, you actually may be receiving a cardiovascular disease risk benefit. You're decreasing your risk for cardiovascular disease. Again, it's only half the studies that showed this, so the evidence is by no means conclusive, and even when they did show it, it was really like a marginal benefit. But all that to say is that we're very confident that up to 600 milligrams, and especially up to 400 milligrams, you are definitely not increasing your risk for cardiovascular disease, which is often a purported negative side effect of caffeine. Also, talking about cholesterol, is you might have a small increase in your cholesterol levels chronically when you habitually use caffeine. So that is one chronic effect that may be true. However, they often purport that this is actually due to other molecules within the coffee, because that is, like we said, the number one source of ingestion of caffeine. They often say that this slight increase in cholesterol, and it is very slight, it's very marginal, could be due to other molecules of coffee versus just caffeine. And actually the same goes for the benefit that you might be receiving for cardiovascular disease risk. They also purport that is likely due to other molecules within the coffee. That is to say, if you took caffeine pills, you may not receive the benefit of a decreased cardiovascular disease risk compared to if you took coffee. That being said, caffeine pills or coffee, both safe as far as they will not increase your long-term cardiovascular disease risk. Talking about some other possible negative effects, heart failure or sudden cardiac death, both have been proven to not be the case, even up to 950 milligrams per day. So even if you're taking 900 milligrams a day, you're not going to increase your risk for heart failure. However, in doses higher than 950 milligrams per day, the evidence is inconclusive on whether that increases your risk for sudden cardiac death. But again, that is a very high dose. If you're like most people, only taking 1 to 400, you're definitely going to be safe. There's not going to be any increased risk for sudden cardiac death. And then finally, one more cardiovascular topic to touch on is cerebral blood flow. We did already talk about how caffeine acts against adenosine receptors in the vasculature to constrict them. So it's something that has been proven time and time again is caffeine decreases cerebral blood flow, for better or for worse. For better in regards to migraines, for worse in regards to brain perfusion in order to provide the proper oxygen and the proper nutrients to the brain. However, the long-term effects of this are really negligible. This is more of a discussion for acute benefits, meaning if you take caffeine when you have a headache, you'll decrease the blood flow to the brain, which is the purported mechanism as far as why caffeine actually helps with headaches. And finally, a couple of more purported negative side effects of caffeine to talk about. One is reproductive organs and fertility and how those are affected by caffeine. You'll often hear that caffeine decreases your fertility. However, in studies less than 400 milligrams per day, this was not the case. Greater than 400 milligrams per day, it was inconclusive as far as whether it affected your fertility. Also, you'll hear about increased fetal loss or spontaneous abortions by taking too much caffeine. Again, up to 300 milligrams in the studies per day was not associated with fetal loss or spontaneous abortions. Higher than that was inconclusive. And we already talked about with pregnancy, that's why it's recommended we're taking less than 200 milligrams per day. And that is why for the regular population that's not pregnant, we're taking 400 or double that because how much pregnancy affects the elimination of caffeine. So to sum all of that up, sum all these negative effects up, if you are taking less than 400 milligrams per day, you are really not going to be having any negative side effects of caffeine. You're not going to be having increased blood pressure habitually. You're not going to be having an increased cardiovascular disease risk. In fact, you're probably having a decreased cardiovascular disease risk, if anything. You're not going to have an increased risk of arrhythmia or an increased risk of sudden cardiac death. All of these risks are certainly not there for less than 400 milligrams per day, and likely are not there for even up to 600 milligrams per day. However, after that, the evidence is kind of shaky as far as where the negative effects lie. So, not a lot of negative effects of caffeine, but are there positive effects? Now let's talk about that. And again, we're going to break these up into acute and chronic effects. So, acutely, what can we see? Well, again, we talked about how caffeine's primary mechanism is going to be adenosine antagonism, and its primary mechanism, even within that category, is within the brain. So, caffeine has, with anybody who's taken it knows, it seems to increase your focus, increase your attention span, and just increase your overall mood. Well, that is due to those adenosine receptors in the brain because it's causing that upper feeling. It's causing those excitatory neurotransmitters to be released at a higher level. That dopamine, glutamate, that norepinephrine, etc., are being released at higher levels because of caffeine antagonizing those adenosine receptors. However, we also mentioned that we can get anxiety because of creating too much of an upper effect. So this is where we need to talk about something known as Yerkes-Dodson law. And essentially, it's also called the inverted U theory. So what the inverted U theory essentially is as we increase our arousal or our sympathetic drive or our excitation, as we increase our arousal to a certain point, our performance will increase. So our attention, our performance even on difficult tasks will increase up to a certain point of excitation. However, once we get past that point, we then start to find a decrease in performance. So if we have too much arousal or too much excitation, we then see those anxiety-provoking effects, and we start to move down that inverted U curve, and we start to lose performance benefits. So, caffeine in studies has been really shown to follow this Yerkes-Dodson or this inverted U theory, because if you give the right amount, or about 200 to 400 milligrams, you can get to the top of that curve where we're going to have the optimized performance without having that anxiety, which is going to decrease the performance. However, if you give too much caffeine, we're going to get into that anxiety provoking level, which is going to decrease our performance. So this also explains why caffeine has been shown to have the best acute effect in those who are sleep deprived, who are fatigued at baseline, who are doing shift work, like me when I was scribing in the ERs overnight. That is when caffeine is going to have its greatest benefit, because these people who are chronically fatigued find themselves on this lower portion of this inverted U. Thus, they need more caffeine to get up to the top of this level, versus those who are not fatigued find themselves closer to the top of that U already. And if you gave them the same dose of caffeine that you gave the fatigued individual, they would fall into the anxiety level. So consistently in studies, they've found that caffeine has the best effect for those who are fatigued and who are tired at baseline. That's when caffeine is going to have its greatest effect. And what are these effects? Well, really, the effects of caffeine can be broken down, as far as mentally and cognitively, can be broken down into two things: lower cognitive function and higher cognitive function. Lower cognitive function being this reaction time, being vigilance, or sustaining your attention for a long time, or increased attention, or maintaining focus on task-relevant issues. So attention, vigilance, reaction time, these are consistently improved with caffeine use. However, again, this is where that tolerance point comes in. Tolerance is going to decrease caffeine's acute benefit here. And it especially occurs with these cognitive effects. We are going to, again, upregulate those adenosine receptors. And by doing so, we are going to decrease caffeine's effect as we continue to take it. However, in the caffeine naive individual, or the individual who's taking more caffeine than they're accustomed to, we are going to arrive very consistently at these acute benefits of increased attention span, increased vigilance, increased reaction time, those lower cognitive functions. The higher cognitive functions, meaning decision making, judgment, risk, reasoning, these higher cognitive functions are very difficult to study, as you can imagine. So it's really up for debate as far as how caffeine affects these. It hasn't been proven to affect them in one way or the other. So that is kind of our cognitive or our mental acute performance benefits, again, occurring at different doses depending on where you find yourself in that U curve. And this is exactly where I can't sit here and say, in order to arrive at the best mental performance, I want you to take 200 milligrams of caffeine 1 hour before your activity. And that's just simply because it's going to really depend on, again, where you lie on that inverted U before you take the caffeine. It's also going to depend on how sensitive you are to caffeine. How much is that cytochrome P450 molecule actually working in you specifically? Are you taking alcohol, or are you a cigarette smoker? Are you on birth control, etc.? There's so many things that go into how much caffeine is going to actually benefit you acutely. And also, probably most importantly, it's going to depend on your tolerance. Have you been habitualized to caffeine, in which case you're going to need to take higher doses than what you're accustomed to in order to arrive at that acute effect. That being said, again, it does have positive cognitive effects for those that are caffeine naive, or those taking more caffeine than usual. So now let's talk about the acute benefits physically, or for training, and that's probably why a lot of you are listening, given the topics of these podcasts. How does it affect our aerobic or muscular power? Well, aerobic endurance, as we already talked about, is increased due to probably a couple of mechanisms. One, we talked about that increased fat use for fuel, and that could be partly what is contributing to increasing aerobic ability. And also, because your caffeine acts in the brain, it's actually acting also as a analgesic, or something that decreases pain perception. So because it decreases pain perception, you're able to go further. Instead of getting these pain signals that my muscles are so tired and sore, you're not feeling that as much, because caffeine is acting as an analgesic by blocking those adenosine receptors in the brain. So aerobic, it does help. In about 80% of studies, it was shown to have a positive benefit on aerobic performance. On muscular strength and power, so we're looking at 1 rep maxes, we're looking at vertical jump. In about 70% of those studies, we also found that caffeine had a positive benefit. And this is likely due to the increased calcium concentration. But like we talked about, that increased calcium concentration only occurs at higher levels of caffeine use, that 300 milligrams. And in fact, what studies cite is that you need to take 3 to 9 milligrams per kilogram of body weight in order to actually arrive at an increased muscular strength or muscular power. And this aligns with what we talked about with the science earlier, and the fact that you have to take higher doses in order to actually arrive at this increased calcium concentration or that increased cyclic AMP, which could result in increased fat use for energy. So in order to arrive, to kind of sum that up, in order to arrive at acute benefits physically for your training, you need to be taking 3 mgs to 9 mgs per kilogram of body weight. So for your 80 kilogram person, that's 240 milligrams at least before 1 hour before your workout in order to arrive at these benefits. And again, like I said, with the cognitive abilities, I can't tell you exactly how much you should be taking, and there's a reason that the range is so high is because of all those effects that I just mentioned that cause every individual to need more or less caffeine depending on all of those different variables. So those are kind of our acute effects. Yes, it improves training. Yes, it improves mental capacity. And again, it all depends on how much you are tolerated to caffeine, how much you have habitualized your caffeine use, and it also depends on a lot of other factors that we just talked about. Now let's talk about our chronic effects here. It's going to be our last section we talk about. Now, again, a lot of these chronic effects of caffeine are difficult to study. However, more studies are being done, and right now we'll talk about some possible potential effects. So possibly it could increase long-term memory in adults, and especially in older adults. However, we need more studies to prove this, and kind of correlated with this is that it also possibly could be protective against neurodegenerative diseases such as Alzheimer's. Now, again, these are just so far have been very not robust studies, and they are things that we are currently exploring more as a scientific community. However, I thought it very interesting to mention here that it could actually decrease your risk for Alzheimer's. One study that is maybe a little bit more robust, actually, it was a randomized controlled trial, which is really the gold of the scientific literature. It was a randomized controlled trial that looked at Parkinson's disease, and specifically the motor symptoms, so the rigidity, the tremors, the shuffling gaits that come with Parkinson's. And it was found that caffeine actually decreased these motor symptoms. And there definitely needs to be more studies to further prove this. But I think so far of the long-term effects that we talked about, a decrease in the Parkinson's motor symptoms is the most likely to be an actual real effect based on the science that's currently available. Other long-term effects, we already kind of talked about how it could possibly decrease your risk for cardiovascular disease. It also could decrease your body fat percentage. And the mechanism for this is not necessarily known, but we do know that, again, as I've said a million times already, caffeine is acting as an upper. So it's increasing the sympathetic activity of the body. And by doing that, we are increasing the energy expenditure of the human of that day. So if you take caffeine 6 times at 100 milligrams a time, it was found that you actually increase your energy expenditure by 5%. So this could be why caffeine actually promotes weight loss and specifically promotes fat loss. And we already also talked about how it possibly increases fat oxidation or fat utilization for energy due to that increased CAMP when we take caffeine at higher doses. So possibly increases fat loss, possibly improves your cardiovascular disease risk. Also, it could possibly decrease your risk for type 2 diabetes. In the short term, actually, what they found was that caffeine decreases insulin sensitivity. And essentially, insulin sensitivity is the marker of diabetes. However, in the long term, coffee consumption specifically was shown to decrease your risk for type 2 diabetes, and specifically coffee. And it was actually decaf or caffeinated. And again, this goes back to our discussion as far as there are other molecules in coffee, including certain antioxidants, that could actually be causing these chronic benefits, such as a decreased cardiovascular disease risk or a decreased risk for diabetes. And those could be coming from the coffee itself rather than the caffeine portion, and that's more than likely the case. However, it can be said with certainty that caffeine is not increasing your risk for diabetes or increasing your risk for cardiovascular disease. Also, another possible, and again, most of these chronic benefits are possible and they need further evidence to substantiate them, but a possible slight decreased risk of certain types of cancer is also possible with caffeine. That has been shown in some studies. And again, some of this comes from the coffee. When they look at decaf versus caffeinated coffee, you get this very slight marginal decrease in cancer risk when you have caffeinated or decaffeinated coffee. So it might not be due to the caffeine, it might just actually be due to other molecules within the coffee. And then the last is you might possibly have a benefit of decreased liver cirrhosis or liver disease due to caffeine use. So a lot of possible chronic benefits that we just mentioned, some definite proven acute benefits depending on how much caffeine you take, and really no risks. So to summarize this and then give you some final recommendations, caffeine at doses less than 400 milligrams per day is 100% safe. It's been proven in many studies. Do not fear any of those purported rumors if you're taking less than 400 and probably even up to 600 milligrams. And it really, even past that, you also might not have negative side effects, but there's just been no studies to prove that past 600 milligrams, you're going to be having no negative side effects. So I can't say that above 600 milligrams per day, you're safe, but I can confidently say that below 400 and probably below 600 milligrams per day, you're not going to have any negative acute or chronic side effects. So with that now, let's talk about long-term caffeine use and short-term caffeine use, and what are my final recommendations based on that huge discussion that we just had. So for long-term, we already talked about there's no negatives, really, if you're taking the correct dosing. You might have these possible benefits. There's going to be more scientific literature to discuss these in the future. So I would say if you enjoy coffee, you don't need to stop taking it. You definitely shouldn't, probably, because it could arrive at these possible benefits, especially if you're enjoying the coffee and you're taking less than 400 milligrams a day. Who knows? You might increase your long-term memory. You might decrease your cardiovascular disease risk. You might decrease your cancer risk or your risk for liver disease very slightly. Who knows? But you are not going to be having any negative side effects. So if you enjoy coffee, you enjoy your tea or your diet soda, etc., feel free. You should keep drinking it. You might get some benefit from it. Now, more interestingly, I think, is to talk about what do we do if we want the short-term effects. And now, again, is when we talk about tolerance, withdrawal, etc. We've talked about this throughout. I said it was going to be important at the beginning. Here it is again. If you really want to arrive at the acute benefits of caffeine, that increased focus, increased vigilance and attention, the increased physical performance of aerobic activity and muscular strength and power, you really need to do one of two things. One, you either need to time your daily dosing around that activity that you're going to perform. So for instance, if every day you want to use caffeine to improve your physical performance, I would not take the caffeine until you're going to perform your training. So if you perform your training at 3 p.m. every day, don't take caffeine until 2 p.m. So 1 hour before, take your 3 to 9 mg per kg, depending on you and depending on all those factors that we talked about. Only take it then, because then you're going to be less habitualized. to the caffeine and it will provide some effect. That being said, if you take it every day still, you are going to see habitualization, and those effects are going to wane. After a week, and especially after a month, taking caffeine before your training session is simply going to be getting you back to your baseline. So with that being said, if you really, really want to arrive at the benefits, you really should be only taking it right before the big event. So if you're an athlete, taking it before the big game. If you're a student, taking it before the big test. For work, right before your presentation that day. By taking a dose of about 200 milligrams before your event that's going to need or necessitate increased mental capacity, you're going to get that benefit of caffeine because you're not habitualized to it, versus someone who already takes 400 milligrams every day, twice on Sunday. They take 200 milligrams like they always do before their event. What they're going to actually be doing is just getting back to that baseline. They're staving off the withdrawal effects instead of actually getting past their baseline, which would be the case if they were not habitualized to caffeine. And what they actually found in studies is that you can reverse your tolerance to caffeine. What they did was they took individuals who were very habitualized to caffeine. They took 400 milligrams a day, for instance. Then they had them go off of caffeine completely for 4 to 8 weeks, and then they retested their effects of caffeine on these individuals. What they found was after the 4 to 8 week washout period, or the period where they didn't take any caffeine, after that period, when they had them take caffeine again, they arrived at those acute benefits just like someone who was caffeine naive or had never taken caffeine. So if you want to really arrive at the acute benefits, you're going to have to stop taking caffeine for a while and then only take it when necessary, when you want to increase your performance physically or mentally. So that is all for the caffeine discussion for today. I know we talked about a ton of things. If you guys have any questions, drop them in the comment section. Hit me up on the socials. I would love to have a discussion further on this. It's super interesting to me. And with that, I will see you guys all next session.